Time now for Morning Rounds with CBS News contributors Dr. Holly Phillips and Dr. Tara Narula, also known as Team Orange this morning. First up, meat and cancer. A major evaluation from the World Health Organization this week found eating processed meats such as cold cuts and bacon increases the risk of certain types of cancer, and the report says red meat likely does the same thing. Holly, there was a lot of backlash to this report that we have to say the North American Meat Institute said it, quote, defies both common sense and numerous studies showing no correlation between meat and cancer. So what are we supposed to make of this?
Well, you know, Anthony, of course, it's no surprise that the $95 billion meat industry is not happy about this report. They have 95 billion reasons not to be. But in no way does their displeasure with the report discredit exactly what the World Health Organization is saying, which is that there is a link between processed meat, red meat, and cancer, which we've known about for a while. So they looked at more than 20 years of studies, hundreds and hundreds of points of data, and finally decided to draw some major conclusions about it and make a strong statement. What they said was that processed meat increases the risk of cancer and that red meat probably does. By processed, we mean things like that have been fermented or salted or chemicals added, things like hot dogs, bacon, some of the yummiest meats, but those carry the highest risk.
Why is it always the things I like?
Well, Dr. Narula, this question for you. I guess when you think about putting eating processed meat in a category as the same as the cancer risk involved in smoking, you wonder, is it really that bad? Can you break that down for us?
I'm really glad you asked that question, because that part of this report has been so attention-grabbing and confusing and misleading. Just because two agents are in the same category doesn't mean that they carry the same risk, the same level of risk. So these two in particular are in totally different leagues. If you think about the lifetime risk of colon cancer, it's about 5%. If you eat a hot dog every day, that goes to 6%. Contrast that with the lifetime risk of a non-smoker of lung cancer, which is 1.3%. If you smoke, that goes up to 17%. So these are huge differences when we're talking about level or magnitude of risk. Estimated that if you eat a diet high in processed meat, that causes worldwide about 30,000 deaths, as opposed to tobacco, which causes about 1 million deaths.
So moderation
is always the key.
So Holly, should we stop eating red and processed meat?
Right. Well, the panel definitely stopped short of saying it's completely off limits, but they also didn't give clear guidelines about how much is safe. There are some nutritionists who work alongside the American Cancer Society they've given us some sort of range. Processed meat, try and limit it to 1 to 2 times a month, and red meat, try and limit it to 1 to 2 times a week. Now, we don't know if these numbers are what will actually protect you from cancer, but it is a start. Most Americans eat much more than that.
Yeah.
All right. Also this week, a new study uncovered an alarming rate of medication errors in the operating room. At one of the nation's top hospitals, researchers found that half of all surgical procedures resulted in some sort of medication mistake or adverse event immediately before, during, or right after surgery. They also found that almost 80% of these incidents are preventable. So what is going on here? I mean, to hear that these sort of mistakes are happening at such a high rate.
That's right. I mean, it's really eye-opening. And we know about this in the general hospital setting, but it has really been understudied and underreported in the operating room setting or perioperatively. So in this study, researchers looked at 277 surgeries at Mass General Hospital, a large academic medical center. And they, in fact, found that 1 out of every 2 operations resulted in some form of medication error or adverse drug event. Over 1/3 of the medication errors led to an adverse drug event. 2/3 had the potential for harm. And when we talk about harm, we're talking about serious harm about 65% of the time. For instance, giving a diabetic insulin and not checking their blood sugar, not giving the antibiotic prior to the first incision in a surgery that would have required it. 2% resulted in life-threatening harms, which would be like giving a patient penicillin who had a history of an anaphylactic reaction to penicillin. But most alarming was exactly what you said, that 80% were preventable.
Wow, those are really high percentages. Holly, what are some of the most common mistakes?
Right. Well, some of the categories where we see this happening the most center around labeling of the drugs, right? Sometimes two drugs look exactly the same, just like clear liquids in syringes. If they're not properly labeled, they really can cause, of course, adverse effects. Giving the wrong dosage of drugs in the OR, as well as issues with not documenting correctly what's happening in the OR, or even not treating a problem based on the patient's vital signs. You know, we do have to point out the OR is a particularly high risk area for this type of mistake to happen. In the rest of the hospital, if you're to be prescribed a drug, maybe the doctor will write the prescription for you, a nurse will look at those directions, then a pharmacist will double or triple check that and dispense the medication, and then before it actually gets to the patient, 2 or 3 nurses have double checked and triple checked that dosage. In the OR, you have to give medicines right away, and that opens up room for error.
And Dr. Narula, does this speak to how people really need to pay attention to what they shouldn't have or should have? I just had a relative in the hospital and they were trying to give her Tylenol when she wasn't supposed to have it.
I wish I could say there was more that patients could do in this particular situation, but when you're in the operating room, you're at your most vulnerable. You can't be your own advocate. And so unfortunately, other than really telling the hospital your allergies, your full medication list and dosages, the burden of this issue falls upon the hospitals and the staff of the hospitals to fix, to create a culture of transparency where errors are really brought forward, discussed, analyzed, and solutions discovered and implemented. And some of the solutions are computerized physician order entry, which takes away the verbal order part, that has drug alerts, that has drug decision support, and also better training of our OR staff, improved handoff. So there are a lot of systems, processes that can be put in place.
All right, for the first time, a new study examined the link between marijuana use and a specific type of stroke in young adults. Tara, what type of stroke are we talking about, and what exactly did they find?
We're talking about ischemic stroke. Ischemic stroke is the type where there's decreased blood flow to the brain that causes cell death. That's different from hemorrhagic stroke, where there's a rupture or a bleed in the brain. We've known about the link between marijuana and stroke, particularly in young people before, but this study really highlights how that might be happening. And so researchers looked at 344 young individuals under the age of 45 who came to the hospital with a stroke, and 18% of those were marijuana users. When they analyzed the different types of stroke in terms of ischemic, the marijuana users more often had something called intracranial stenosis, meaning narrowing of the blood vessels with plaque in the brain as the cause of their stroke, as opposed to the non-marijuana users who had what we call cardioembolic stroke, meaning a clot originated somewhere else and traveled to the brain. Why is this important? It tells us that marijuana may not be as safe as we think, and that it could be physiologically, architecturally changing the brain.
All right, Doctors Holly Phillips and Tara Narula, thank you both for being here this morning.
Thank you.